The next question is from Hilary Beaumont from Al Jazeera. La question suivante est de Hilary Beaumont de Al Jazeera.
Hi, thank you for answering our questions today. I'm wondering, could you please explain exactly how Canada's protocols for respiratory outbreaks have evolved since the SARS outbreak? Thank you.
Yes, so obviously globally, public health capacity has increased significantly. Canada was a country that actually had SARS cases, and since then, there's been a number of ramping up of our public health capacity and coordination. So, first of all, the Public Health Agency of Canada came into being, if you like. It was established together with other provincial public health agencies as well, Public Health Ontario. And we're working very systematically together through a federal, provincial, and territorial governance called the Public Health Network Council. And this allows us to stand up very quickly, such as in this instance, as I've just said, we're going to have a special advisory committee with all our provinces and territories to coordinate the response. And we have all the chief medical officers participating to ensure we have consistency and essentially approach this event in a consistent way. We have actual response plans in place. So we have something called the Federal, Provincial, Territorial or Response Plan for biological agents, amongst other plans, and a pandemic influenza planning guidance, which can be relied on quite heavily, I think, as well. And we've established emergency operations centers, incident command, incident management structures. So these plans and protocols are there already. We've also strengthened our laboratory capacity, not just at the federal level, but we have a network of provincial laboratories. And you've seen how Public Health Ontario lab is able to now do these testing. And, you know, the objective of the National Microbiology Lab is reference and standardization, but we want as much of this testing to be rolled out across Canada. And so I think it's a combination of the capacity, the necessary structures to rapidly ramp up our response, and our plans and our technical capacity as well. And providing guidance to all the jurisdictions so that we can all work off the same sort of approach is really important as well.
Great, and just one follow-up. I understand you're saying a lot about communication improvement and plans in place, and I'm just wondering, has screening specifically changed since SARS?
You mean at the international border?
Yeah, all along, so when someone comes into Canada, et cetera.
Yes, no, as I've said, it's a sort of multi-layered approach. And so I actually think that one of the most important points of screening, if you like, is actually at the healthcare system interface. So being able to communicate rapidly to the chief medical officers who inform the hospital to put them on alert is very, very important, because the hospitals then need to have the process in place for asking travel histories of everyone, and also knowing about this new virus and where the travelers are linked to. So I think that across the country, strengthening as a foundation for hospitals, infection prevention control measures, and these kind of protocols are very important. So that screening takes place at the interface with the health system. And so, of course, at the international border, as I said, this is not, this is only but one layer, and relying on that layer alone is not sufficient. It is definitely an opportunity at the border, using new technologies too, like these kiosks that can help us, help passengers also to identify themselves, and then providing the information that's needed so that people can transition safely into the health system I think is very key. But I'd say that, Toronto, having experienced SARS, we know how important that front line and the hospital screening and infection control measure actually is.
Thank you so much. I appreciate it.
Thank you. The next question is from Elizabeth Payne, the Ottawa Citizen. La question suivante est d'Elizabeth Payne, du Ottawa Citizen.
Hi, thanks for taking my question. Can you tell me what numbers of testing have been done to date? Do you have a figure?
So, from our National Microbiology Lab, this number, of course, can change over quite rapidly. My understanding is that we have been testing about 25 patient samples, and to date, as you know, our lab at least have confirmed the one, and we expect the second confirmation to be done as well. Public Health Ontario, of course, has already tested positive these two cases. So those are the numbers that we have. Obviously, you're going to hear about a whole number of people under investigation by the provinces. Some of them may or may not be tested. It depends if they are compatible in terms of their symptoms and their travel history.
Okay, and can you just clarify for me, if Ontario has a rapid testing lab, why are they then going to Winnipeg and waiting for confirmation? Is that necessary, and is that system sustainable if you start getting higher numbers that need testing?
Yeah, so I think it's great that Ontario has that capacity, and a lot of this is collaboration across Canada's laboratories. So at the beginning of the emergence of a novel virus with new tests, what is done is that a second sample is sent so that we can provide quality assurance and standardize those tests. And I think that this is just something that we would do at the beginning of any of these novel emerging disease outbreaks. Standardization is important. And so, but just to be very clear, Ontario will act based on their test results. So they're not waiting until the Winnipeg test comes back to actually manage people from a clinical perspective or contact tracing. So everything like that happens when Ontario got that positive. Of course, not all jurisdictions have the same capacity as Ontario, and the Winnipeg lab is there to support those jurisdictions who cannot do the tests themselves.
Okay, so this is to make sure the testing is where it should be because of the coronavirus is new. Is that a sense? That's what's going on with this?
That's right. And in the end, we would like any lab in Canada that has the capacity to do it to be able to do that.
Okay. All right. Thank you.
Thank you. Merci. The next question is from Sarah Sears with CBC. La question suivante est de Sarah Sears de Radio-Canada. Please go ahead.
Hi, good afternoon. Dr. Tam, how worried should Canadians be for the novel virus at this point?
So I would say that if you're in China, this is a serious situation. It is a serious public health threat that we must, be very vigilant and prepared for. If you're in Canada, our current assessment is that the risk remains low. We will expect individual importations, just as we've just seen in Toronto, in Ontario. And the important thing then is to rapidly ensure that the further spread doesn't happen in Canada. So even if we have another imported case or subsequent ones, that's not unexpected. And as long as it doesn't spread in Canada, our current assessment is that the risk is low to the general public. Of course, lots of things can change over time, depending on what's happening with the outbreak in China, etc. So the more we learn about the spectrum of illness and how severe this coronavirus disease is, we will be adjusting our risk assessments accordingly. But currently, the risk to Canada remains low.
And what would an elevation of of precautions look like if you need to take it in Canada?
So, right now, globally, we are in what we call a containment response. So we're trying to keep the sort of virus in its box and trying to put it back in this box. So there's a massive global effort. We will continue to prevent spread from any importation. Let's just take the scenario further. What we don't want to see, for example, is spread further than that. And if that happens, we have public health guidance and protocols in how we manage larger number of contacts and other public health measures. So at the local level, we already practice this regularly for other infectious diseases as well. So for the contact tracing, sometimes they may be place-based, not just a single individuals, but certain settings maybe in terms of contact tracing as well. And so that will definitely come into play in terms of escalation. And so obviously also for the healthcare system to be prepared to take on more cases. We also rehearse this all the time when there's influenza season and there's increase in the number of people with pneumonias and respiratory illnesses. So, the ability to surge and isolate and manage patients, of course, is a very key part of some of those next set of scenarios as well.
Thank you. The next question is from Brian Lilly with the Toronto Sun. Question suivante est de Brian Lilly.